My name is Walter Greenberg, PhD. I'm a clinical psychologist and I practice in Brentwood. In college, I had a fairly serious injury. My life was changed. I spent 6 months in the hospital and I worked with a psychologist at that time because I was pretty depressed and my life was changed, and that set me in the direction of wanting to do the same kind of work. I have a clinical appointment at UCLA and I get to do some lecturing in both the dental and medical schools on dealing with patients and clients and sometimes dealing with their own feelings. Once we start, the process of defining the problem is related to developing the goals in terms of what people want to do. So part of it is helping people to clarify what their goals are so that we can work towards them. As a cognitive therapist, when you're working with people, it tends to be quite active. It's a lot of questions, it's a lot of reflections, it's moving from point to point. It's not so much, well, how does that make you feel? And then I'm quiet and wait a long time. So it's a much more active process. Well, if somebody were saying that they're depressed, you might start asking questions. What do you mean by being depressed? Is it a feeling of sadness? Is it a feeling of loneliness? Has it affected your behavior? Have other people commented on it? What do you think the cause is? We might go through a whole lot of different ways of looking at it and helping to understand what the problem is so that it's not just a one-word or one-sentence statement about how they feel. I guess what I would say about me in one sense is I'm not incredibly touchy-feely. That I do a lot of work with men, I also do a lot of work with women, but that I'm not only going to focus on feelings with people. While that's an important part of things, the kind of cognitive mental experience and behaviors are equally important a lot of the time. So while I certainly do connect with people emotionally, I don't think of myself as soft and mushy. The joys and satisfactions of the work is the strong and deep connections that you have with people all day long. To sit with somebody for an hour of their time where they're very focused on what's going on and I'm very attentive to what's going on is a very deep level of communication. And in some ways that's what many people are looking for to have more of in their life. And I have the satisfaction of having it frequently during my day.